Echo TV is a co-production of Minnesota's Emergency, Community, and Health Outreach Collaborative of health, safety, emergency preparedness, ethnic and nonprofit agencies, and TPT's Minnesota channel.
Hello and welcome to ECHO, which stands for Emergency, Community, and Health Outreach. I'm your host, Lillian McDonald. We bring you information on health, safety, emergency, and civic engagement topics. And this topic this time is about prenatal health. We have some guest experts, but first, we want you to learn about prenatal health. Please watch this.
Becoming a parent is something that will have a huge impact on your life. When you're expecting a child, you have a lot to think about and a lot to do to get ready. It's especially important to pay close attention to your own health while you're pregnant. Taking good care of yourself helps both you and your baby. Even if you've had children before, you might not remember to do everything you should. You can start by making sure you regularly see a healthcare provider. Your healthcare provider can be a doctor who specializes in pregnancies, like an OB/GYN, a family practice doctor, a certified nurse midwife, or other health professional. By going to regular appointments, you and your health professional can make sure your pregnancy is going well and your baby is growing healthy. You can also find out if you're having any issues or problems with your pregnancy and learn what to do so they don't become more serious. You'll also find out if you need any vaccinations, and of course, when your baby is due. When you're pregnant, it's very important that you eat a healthy diet, which includes lots of fruits and vegetables. Don't forget to include plenty of grains, milk products, and protein. You don't have to give up all your favorite foods. Just try to limit the unhealthy ones as much as you can. Also take folic acid regularly. Folic acid is a vitamin that helps prevent birth defects. Do not use drugs or smoke while you are pregnant. Drug and tobacco use can cause serious harm to your baby. Avoid even being around people who are smoking. You should also limit the amount of caffeine you drink, and do not drink alcohol. Alcohol can also severely hurt an unborn child. Babies of mothers who drink while they're pregnant can be born with fetal alcohol syndrome. Those babies are often undersized or have developmental problems as they grow. It's important to stay active while you're pregnant. Try to get 30 minutes of exercise on most days. It's safe for your baby and helps you build up stamina for childbirth. Your mind also needs to stay sharp. Attend childbirth classes, which will give you important information and connect you with other pregnant women. This will also help you build a support network, people you can turn to who are in your same situation. Becoming a parent or adding a child to your family is exciting and joyful, but it can also be stressful. Build up your circle of support before your baby gets here. The people around you can help. Share your feelings with them and don't be afraid to ask for help or talk about any concerns. Taking care of your mind, body, and spirit gives your baby the best possible start to his or her life.
Welcome back. You're watching ECHO, Emergency, Community, Health, and Outreach. I'm your host, Lillian McDonald. This topic is on prenatal health care. We have three guests to talk about this subject. First, we have Dr. Virginia Lupo. She's OB/GYN, physician at Hennepin County Medical Center. We also have Maria Pedersen, the Director of Health Partners Midwife Services. And also Rhonda Hunt, who conducts home visits on behalf of the Division of Indian Work. Ladies, thank you very much for joining us on ECHO.
Thank you.
Yeah, very important topic, very interesting too. Let's start with just the basics. We've got a lot of questions here, but let's just get some groundwork. In addition to the recorded piece that folks just watched, what exactly do we mean, Doctor, by prenatal health? Just that simple focus.
Prenatal health is taking care of your mind and your body, getting ready for the baby. and it's getting both of them in the best shape you can to prepare for having a healthy baby in 9 months.
And that's important whether it's your first child or your fourth or more child, correct?
Absolutely.
Prenatal care is very important. The important steps to taking care of your body, obviously undergoing lots of changes when you're pregnant.
I would argue that some of this starts even before you conceive. If you have diabetes, if you're on some depression medicines, if you're on seizure medicines, think about seeing your doc or nurse practitioner even before you get pregnant. And then, and hopefully be on vitamins even before you start trying to conceive. Ideally, women should see somebody regularly throughout pregnancy. Don't just come in the last month when you feel the baby's due for your first visit. Eating healthy, living healthy, exercising is a great thing to keep you in shape and to optimize things for the baby. Stay away from dangerous things. There is no safe level of drinking alcohol in pregnancy that we know of. Smoking, that's something you don't need and your baby doesn't need. Just decide that this is going to be a healthy time for you. Check on whatever medicines, whatever diet supplements or herbs you're taking. Mention them to your doc or midwife at your first visit and just tee things up so that you're completely on the road for success.
Yeah, this is a complete teamwork between parents and children in the development of healthy babies. And they can help you. Providers, physicians, doctors, nurses, and others can help you if you are a smoker, for instance, and you need to stop smoking because your body will be going through lots of changes. Fair enough?
Definitely.
Okay, great. Well, who should I go to for medical care? Maria, I mean, is it always just a doctor? There are others?
No, I'm a nurse midwife, and I have a large prenatal caseload. A nurse midwife is one of the choices in the community, and obstetrician gynecologist would be a second choice. Family practice physician who does prenatal care is another excellent choice. It's really a personal preference. Family practice physicians and myself, we do manage low-risk pregnancies. Somebody like Dr. Lupo, she would manage patients that maybe have some health concerns or had other issues in other pregnancies. So it really is a personal preference. Wherever you go, however, you should be able to make a choice of a male provider, female provider. And the other thing is that most places now would offer interpreter services or help you find an interpreter if you don't have somebody that you know of.
And that makes sense. ECHO, this broadcast, we provide information in multiple languages serving our Hispanic, African, Southeast Asian, and other communities. And it is important to ask for an interpreter if you feel you need that service as well. There's a lot of communication that goes on during the entire care of the baby and your body as you go through this change in your life.
No, it's not just right to have your 10-year-old child interpret for you when you're talking about medical things like this. And as I understand, almost every health plan has some kind of financial coverage for an interpreter. So if there's a question, ask your health plan, but you really deserve to have an interpreter working with you.
Yeah, and that's a good point. Many children become the interpreters of families navigating health changes, and that's traumatic. That's traumatic.
Not appropriate in many instances.
No, it clearly not. What about types of food? Obviously, there's a lot of talk about the types of food as your body changes and your taste changes as well when you're pregnant.
Right.
But before you're pregnant, types of food is important.
Well, in 2 words, I guess, healthy diet. Yeah. That would be the healthy diet. But what does that mean? A variety, people should really have a variety in their diet. So a lot of us are aware that there's 5 main food groups. Those food groups are protein, so that's meat, red meat, chicken, fish, dairy products, cheese, yogurt, milk, fruit, vegetables, and then grain products, bread, cereals, rice, tortillas, things like that would be considered a grain. The other thing is that vitamins and minerals are incredibly important. Many of you, when you're pregnant, would be told by your provider that you need a supplement, either prenatal vitamin, regular vitamin, or even iron during the pregnancy. Calcium and folic acid. And actually, folic acid is something that should really be thought of preconceptually. That would be important to start as soon as you're even entertaining the idea of having a baby. In terms of weight gain, a lot of women, it's one of the first questions they ask when they come in for their care. How much weight? You know, what if I'm already too heavy? I don't want to gain too much weight. Those are questions that come up right away. And so you need to talk to your provider about that. A lot of how much you should gain in your pregnancy should be really determined by what you present, how much weight you come in with.
That makes sense. Now, the importance of adding vitamins and minerals like folic acid or calcium to your diet, is it just because you can't get enough of that in the foods you eat, and that's why you need the supplements?
Yeah, well, and also the baby in some ways, you know, you can almost say is like a little parasite that leaves you the leftovers. And it's very hard, even when you're not pregnant, to consume the vegetables and fruits and even the calcium, as an example, that is recommended. We don't even do that. And
so
we're
it
not
is good
pregnant.
to have a supplemental
Right,
vitamin.
right. And your provider can help determine what that is.
What's best for you. Well, what about what food should pregnant women avoid? What should we not have if we're pregnant? Obviously, the doctor mentioned, you know, avoid alcohol, avoid smoking and things, but are there any foods that pregnant women should avoid altogether? Ladies?
Well, one of my personal favorites is fast food. I think that, you know, your fast food, more and more fast food restaurants now are really being compelled to offer some healthier choices. So it's, you know, you can't say that it's all bad, but to really choose as best you can if you do go to those types of places. I think that the majority of foods on the menu would not be really considered healthy.
Okay, so try to avoid the junky foods associated with fast food restaurants.
Correct.
What else?
Deli meats, and also some deli cheeses. There is a bacteria that's called Listeria, which can be harmful to you and your baby. So unless, you know, you really need to follow the expirations, you shouldn't buy in big bulk because it tends to spoil quickly. So that is something to be concerned about.
So it's not that deli meats are bad, it's just that,
just
again, they are
careful
stored
about,
and they come with characteristics that
Right,
don't last.
Right.
I think a big listeria problem is if people go to a farm somewhere up north and want to drink milk that's completely unpasteurized. That's one of the few places where we tend to see listeria these days. So there's something to be said for pasteurization.
Okay. And so fish is good for you, but there are certain kinds of fish that aren't so good, right?
Right, and that's because of the mercury. I think kind of a rule of thumb that people think about is your large fish that aren't necessarily even available here. You know, we don't have an ocean here. So some of your larger fish that eat the smaller fish, because when you think about it, the mercury in the small fish and then the mercury in the big fish. And, you know, if you have any questions, there are some publications out that are that you can retrieve online if you have access to a computer. That really is a very good resource about what fish, how much fish.
And it doesn't mean that the fish are bad, but everything in moderation, and again, choosing carefully.
And then certain fish.
And then lastly, raw vegetables might be worth avoiding.
Washing is a good thing, washing your fruits and vegetables. And certain things like alfalfa, clover, mung beans, your undercooked meats, you want to cook everything thoroughly.
And that's good advice, pregnant or not, right?
Right.
Okay, good. There's been an increase lately in, unfortunately, gestational diabetes across all cultures. And one question is why? Why is that, and how to avoid that?
Well, the increased risk of diabetes goes along with the increased obesity that is present in America today. When a woman is diabetic, her blood is sweet. And if mom's blood is sweet, the baby's blood is sweet. Babies don't like that sugar. That sugar causes many, many different kinds of complications. So we try to teach mom to eat so that her blood's not so sweet, so that the baby's is not so sweet. The best way to prevent this in the first place is not necessarily avoiding sugar or sweet things. Eating sugar doesn't cause diabetes. What causes it is something going wrong with your liver and pancreas and just how you handle sugars and fats when you eat them. The best prevention, the best treatment for diabetes is exercise. 15 minutes walking around the block in the neighborhood after dinner is an incredible preventer against diabetes and a treatment for it. The good thing about diabetes in pregnancy is that it almost always goes away at the end of pregnancy, but it's a sign that you might have it when you turn 50. So your biggest hope on that is exercise and stay in good shape.
So keeping that body moving, keeping the right amount, right mix of foods coming into the body. Healthy foods, fruits and vegetables in particular, will help keep you healthy and avoiding diabetes.
And keep moving.
Keep moving. Good to note. What about things to avoid in the environment? What kinds of things might we avoid environmentally?
The most common thing I see questions about is changing kitty litter. If you have an indoor cat, you're probably fine. But if cats can go outside, they can run into mice, rodents, and they can catch something called toxoplasmosis. So don't be around kitty litter if there's any chance in the world this cat has been outdoors.
Okay. Hot waters as well. We're talking about saunas, hot tubs.
Yeah.
Heat's not good for you, huh?
Really, the number on that is that you shouldn't be in something over about 102 degrees.
Okay.
Most of us would feel that we were poaching if we were in something that hot, so that's usually not a real problem.
But a hot bath feels good every now and then.
102, usually we're
little
starting
too
to
hot.
climb
I
out of the
tell my
tub.
patients if their skin is turning red, if they feel like they're going to pass out, or suddenly they just feel almost sick feeling, that water's too hot.
Time to get out of the water.
It's too hot. It's too hot.
And of course, some lead exposures that come up sometimes within pipes and faucets or paints. You should have that checked anyway as well. What about getting a flu shot? Isn't that a good thing to do?
A pregnant woman can have any vaccine that's dead. She cannot and should not have any shot that's live. So when you're looking at the different shots out there, the only question is it dead or alive? A flu shot is dead. It's made in totally artificial circumstances, and it is completely safe. And if mom gets a flu shot, not only is she protected against flu, but her baby is for at least several months after the baby is born, because he gets all those passive antibodies coming across to him. So like the CDC says, get your flu shot.
Get the flu shots. Would you agree with that too?
Yes, I would.
Okay, all right. The exercise, we've talked about exercise is very important. It increases energy, it builds stamina for the eventual birth of the baby, and relieves stress as well, and helps you manage some weight gain. But how much exercise?
Well, whether you're pregnant or not, everybody should exercise probably about 20 minutes to a half an hour today, every day. Some type of exercise, dancing, walking. Swimming is wonderful exercise.
Yeah, keep it simple if you can.
Yeah,
You
swimming.
don't have to have a membership to a club, right?
Well, no, not necessarily. Rent a video. Get out and walk with your friends. There's plenty of every different facility. If you have a membership, if you're lucky enough to have a membership, there are multitude now of even pregnancy yoga, pregnancy, different types of exercises that are even geared toward pregnant women. Women, or if you talk to somebody at your health club, they'll even tell you, you know, this is what you should do now that you're pregnant to tone it down. Exercise should not feel bad. So, you know, if your healthcare provider tells you there's reasons you shouldn't exercise, then you shouldn't. Those are very rare instances. But, you know, exercise should not feel bad. So if it does, then you should.
Then that's when you want to stop.
That's
now,
when you
Rhonda,
want to stop.
we know it's important to have some support while you're preparing to give birth. What are some resources that you might get some support from?
Like attending a childbirth education class at the hospital where you're going to deliver, and especially for Native American people, I know it's there's a lot of good resources in South Minneapolis. Relying on family and friends for support. And parenting classes, maybe getting like a home visitor. It's really a good time to rely on healthy people to have a healthy pregnancy.
That makes sense. Your body's going through physical and emotional changes too, so it will help to talk out. And of course, your provider can give you some suggestions of places to go that are organized and formal to sort of help you through that process.
I think another good resource also is a lot of the health plans. Many of them have some care coordination or a hotline to call for prenatal care, and they can really tune you into some resources that just aren't available to women who aren't pregnant.
Right, like doula services. You know, a doula can be there through the
I've
labor
had some
and delivery.
friends that use doulas, and they just absolutely really appreciate someone who is just right there the whole time. No offense to physicians, of course, doctors who are also there, but sometimes it's the relationship. The relationship. You don't get to see and build a strong relationship with your physician, or maybe as strong as you'd like to in pregnancy. The doula seems like there's more available for you.
Even for something as simple as getting to visits, call, and there's probably some resources available to help you with transportation that a lot of people don't realize.
Essential.
That's such a simple but huge barrier.
Now again, why is it important to have regular health care provider appointments? Maria, you said this before, but let's just emphasize it
Well,
again.
it goes to what we just really were talking about. It's building a relationship and a trust relationship with the person you're seeing, and that takes more than seeing somebody once. So it's to get the advice you need during the pregnancy, to make sure that you and the baby are healthy. You have to be seen in order for us to know that. To talk about vaccinations that you may or may not need during the pregnancy. Offer advice about pregnancy, and as we were talking about the resources, many times I may know some things too that it's your first baby, you may not even know that are really out there. So you have to come, we're a very helpful resource.
It sounds all good, but sometimes some unfortunate things can happen, and there are some danger signs that women should look out for. Doctor, what kinds of danger signs should women look out for during their prenatal and then eventual pregnancy?
Lillian, if there's one huge thing I tell people loud and clear, pay attention to whether your baby is moving. Stillborns happen without reason or preceding cause a lot of the time. It's not something women do wrong most of the time, but it's really something to watch for. If you just don't think the baby's moving, don't blow it off and say, well, I have a visit on Tuesday, I'll talk about it then. If you really think he's not moving, stop, have something to eat, and just focus on the baby for half an hour. And if he truly does not move, please call your hospital right away. I don't care if it's 3:30 on Saturday morning. If it's something that's just really different from the pattern you've had, call. You will never be blown off by a labor and delivery nurse answering the phone. She'll be very concerned.
Take you very seriously.
Yeah. Other things, of course, are watching for preterm labor. If it feels like your tummy is having a cramp every 10 minutes, and you're not due within the next week or so, call. That could be
That's not a contraction, could be a problem.
Could be a contraction, could be preterm labor.
Okay.
Call. Talk to someone else and have them help sort that out for you. If you're bleeding, if water's coming out and you think maybe your bag of water broke, call someone and run that by a nurse or a phone line to see if something's going on. And then the other possibility, if women have high blood pressure, usually at the end of pregnancy, women can say, I have the worst headache I have ever had. Never ignore that in your life. If this is just something that is really different, really bad, call.
What about swelling or other discomfort that just comes with being pregnant?
Probably 80% of pregnant women swell. If you eat Chinese, you're going to swell the next day.
Or if it's August and it's 100 degrees outside.
Or if you go to the state fair.
Yes, exactly.
So that's not as concerning as a really bad headache would be. But if you wake up one morning and say, my goodness, I had ankles yesterday, they do not exist right now, it's worth a phone call.
How about emotional changes, Rhonda? Can you help us a little bit with the emotional changes that you may go through? Moodiness?
And moodiness and depression, and it's something that you should talk to your healthcare provider about, whether you're seeing a nurse practitioner or a doctor or OBGYN specialist. They can help out with therapy, support groups, and in some cases, medication can get you through that.
And insurance. What if you don't have insurance? I mean, these are expenses that are adding up. I'm listening to them in the conversation. How do we pay for this?
There's a lot of resources that can help at community clinics located in the neighborhood where they have social workers that will help you apply for medical assistance or Minnesota Care government paid medical assistance.
Again, ask around, check with the insurance, and ask around.
And then WIC 2 is a nationally funded program where the pregnant lady can receive nutritional benefits through like the grocery store. They get vouchers, and it can be milk, eggs, cheese, peanut butter, all those nutritional supplements that mom and baby need.
Women,
to be
Infants, and
healthy.
Children program. Wonderful. Ladies, I really appreciate your time and your expertise on all of this. There is a ton of information here, and we'd like to encourage folks to, again, ask the provider, ask for more information, and you can follow up on our website too for details and other resources that will help you, and we'll give you that website in just a second. But I'd like to thank you all very much for your time and your expertise today on ECHO. I really appreciate it. There's basically three or four key messages to remember from all of this information. The first one is, when you're pregnant, see a healthcare provider regularly, whether or not it is your first child or if you've had children before. It's important to stay in touch with your provider. Eat healthy foods while you are pregnant, and don't drink alcohol, smoke, or use any drugs of any kind. And use support services to stay mentally, physically, and spiritually helpful. And lastly, prepare both your mind and your body for childbirth. And there are resources available. Again, thanks to all of our guests for watching ECHO, and to our audience as well. If you'd like more information, we ask you to visit our website, echominnesota.org. I'm your host, Lillian McDonald. Until next time, have a great day.
ECHO TV is a co-production of Minnesota's Emergency, Community, and Health Outreach Collaborative of health, safety, emergency preparedness, ethnic and nonprofit agencies, and TPT's Minnesota channel.